Welcome back. You're still watching PM Express, and my name is Famous Kwesi Atichagbi, sitting in for Nananta Kwao. Now, the WHO report of 2015, as at 7 February 2015, indicated that 22,800 cases have been reported so far on Ebola, with 9,000 deaths recorded so far, with Liberia being the hardest hit. But this evening, like I said, we're going to move away from the figures and statistics and all that and go really down to the grassroots, where people are ignorant about Ebola and very ignorant about cholera. Well, like I said earlier, I have with me two persons. I have with me Madame Cecilia Senu, who's the Executive Director for Hope for Future Generations, which is a health NGO. And also I have Abdul Majid Ayebere, Zonal Coordinator for the Institute of Social Research and Development. Welcome, ladies and gentlemen. Now, let me ask you, I'll start with you, Abdul Majid. What is this approach to dealing with Ebola with focus on community?
Thank you very much. Like you did say, we got up one morning, we heard of, the deadly Ebola disease, and everybody was put on alert because you look at the number of deaths that were recorded. You look at the mode of transmission. This is something that really was very scary. And so for us, as a consortium, we thought that it was very important that even though we have not recorded any single confirmed case of Ebola, but it was very important for us to put our house in order, simply because we found ourselves within a geography surrounded by countries that had been, hard hit by this particular disease. You talk of Liberia, we are not too far from them. You talk of Sierra Leone, you talk of Guinea, and even Nigeria. And so for us, we thought that it was very important for us to really, get to the ground, conscientize our people about this particular disease. Let's not sit and be caught unaware of this particular disease. And so what we seek to do as a consortium is to make sure that we send the right type of information.
A consortium made up of how many NGOs and how many partners?
Yeah, a consortium of 3. That is Institute of Social Research and Development, Hope for Future Generations, and then Youth for Youth Development and Research.
So these are 3 NGOs.
These are the 3 NGOs.
Are these health NGOs or NGOs which are, what are they primarily into?
Basically, we have a number of areas that we work in. We are into health, we are into gender-based violence, we are into women empowerment, into a number of things that really seeks to improve, the livelihoods of, the vulnerable ones in society. So at the end of the day, we are not just limited to health, but then it is a multiple tax kind of, things that we do as NGOs. And back to, the issue. So for us, we thought that let's come together, okay, put our energies together, because these are NGOs that through workshops and other platforms we have met, we have been able to identify our, varying strengths, and we thought that we could pool our energies together, we could pool our different strengths together, and then also contribute our quota in this particular regard. If you take Ebola, for example, it has become a disease that everybody must get him or herself involved in terms of its fight, because it's something that should not be limited to only people within the health sector. It's something that should be limited to government, but you, I, and everybody must get involved. And so all we seek to do.
But before you go on, let me ask you, what really informed your decision as a coalition of NGOs to decide to adopt this strategy? Because we all know that when this thing first struck, the Ebola scare first struck, there were many interventions. The president spoke about it, many persons in the health sector. Everybody was worried. The Ministry of Health, in collaboration with the Ghana Health Service, have put in measures. There were isolation centers everywhere. There were campaigns to educate people about on the preventive mode, or prevention of Ebola and all that. There was a lot of media hype on Ebola. But then I'm asking, you decided to adopt this approach because what? You felt that the message was not adequate enough, they didn't get to the right persons, or you felt that you just wanted to add to the numbers? Yes, you can take that.
I think the whole Ebola issue is behavioral change. And behavioral change, you cannot just do it and stop.
Yes.
It needs to be sustained. I mean, and using multiple approach, different approach, because we realize that everything can be, Ebola can be prevented. And we are community-based organizations. We are directly in touch with the people. We know the health people are doing their technical part. But the strength of civil society is community mobilization, communication to communities, partnering with media houses and others. So that is what we are using. We are using the traditional leaders. We are using a community-based organization. We are using community structures, social groups, churches, different strategies that maybe the health sector might not focus too much on because they are looking more at the technical part. So the role that we are playing is basically community mobilization, and that is if you look at the national preparedness plan, civil society component is basically...
Do you think that Ghana was prepared for Ebola? Do you think we still are very prepared for Ebola? If we have a case of Ebola today, do you strongly feel that we'll be able to contain it?
I would say we are not fully prepared. I think when the thing started...
To what extent are we prepared?
You know, when the Ebola issue came, we quickly put up isolation centers.
But these are isolation centers which were overtaken by weeds, and you go in there,
exactly.
There are no protective gears, and it appears... I mean, I know there were simulation exercises at the Kotoka International Airport and at the various border points, but then even still, talking to many health experts like Professor Alex Dodu, who works with the WHO, he has said categorically clear that no, he thinks it's a joke, that we are not prepared, ready enough to combat Ebola.
Yeah, that is what I'm coming up to. You know, we make so much noise. I mean, we talk, we do a lot of talking, promising, but when it comes to actual implementation, that is where we have a gap.
So where have we gone wrong with the Ebola campaign?
I think the government has showed the leadership, but whether that leadership is actually reflecting on the promises that they made, I mean, that is where we have a challenge. Ghana Health Service Ministry of Health, from the beginning, everybody was very much alert, but you realize that...
very typical of us Ghanaians.
Typical of, and then a lot of plans, a lot of paperwork, and a lot of resources, calling donors to bring in money. But whether we are really, really following the plan that we ourselves put together, that is the issue.
So for you as a coalition of NGOs, what should be the plan?
We are consortium, not coalition. We are members of the coalition, but this is a consortium of NGOs who are members of the coalition of NGOs. I think our plan is to get to our people. I mean, people on the ground that many people might not think about, though they are doing it in a way, because we are directly using existing community structures that nobody thinks about, things that directly working with traditional leaders, using churches, using women groups, using school children, using everybody who really know what to do and change common behavior. You know, Ebola is, you know, our funerals, the way we respect the dead, it can transmit Ebola. The way we receive visitors and all those. I thought Ebola
gave a real boom to hand sanitizers, because then the perception you got out there was that everybody now gets the impression that Ebola is transmitted via handshake mainly. So suddenly, almost everywhere you go, sanitizers were being sold everywhere, and people really made good money out of the sale of sanitizers. And for most of us, we were thinking, oh, two things. Make sure you use sanitizers, make sure you wash your hands, and make sure you don't eat bushmeat, and you're free, Ebola free. That has been, even for those of us who are educated. Go on the streets right now and conduct a survey and ask people questions. What do you understand about Ebola? You realize that the education is still not there. People will think, oh, preventive, simply, just wash your hand with soap, use hand sanitizers, and avoid bats, bushmeat, and you're good to go.
I think maybe just to take it before my colleague come in. You see, we also try to, these myths and misconceptions about the disease. These are some of the things that we try to address in the community to know the real issues.
Deal with the myths and misconceptions of Ebola. Let's assume that people do not know. For a first-time watcher, what are the myths and misconceptions of Ebola?
You know, there are people in the rural areas. I remember in one of our stakeholders meetings, somebody was asking if a mosquito could really, cause Ebola. And that clearly showed the level of ignorance at that particular, level, you understand?
Yes.
Besides that, there have been others who have also thought that, Ebola is more or less a spiritual kind of, a disease. You get the point? And so, and there are others who also even still think that, look, there is no way Ebola would ever come to into this particular country. And some are there who even think that those of us who go around talking about Ebola, we are those who are trying to invite the disease into the country. So there are a number of, issues out there. But I think that as a people, once our neighbor's house is on fire, the most appropriate thing for us to do is to make sure that we fetch some water, put by ours in readiness, that in case it jumps to our place, then we can safely quench, to protect our houses. So always try to let them understand is that this is really, a disease that is real. It is not like a misconception. It's not like people are hyping it beyond imagination. But it is something that has taken so many lives, and it is something that we all have to be conscious of. And all you try to do is to alert them on their symptoms, alert them on the modes of transmission, alert them on the simple basic things they can really do to protect themselves from this particular disease.
Ebola has an incubation period of 21 days.
Exactly.
And we all know how porous our borders are. From our airports to our border areas and all that, it's too easy for anyone to have come in with Ebola. Can you hazard a guess as to why Ebola never came to Ghana? Because there's a lot of migration across the borderlines. So I wonder, how come we never reported a single case of Ebola? Is it to say we are more pious than the Pope? Is it that we are a very religious nation, for which reason God decided, oh, okay, you are my chosen people, so no Ebola for Ghanaians?
Maybe I can talk. WHO came out to talk about the risk of traveling, I think minimal risk of traveling when there is Ebola. For example, if you sit in a plane and that kind of thing, it is not easily contracted. But I think from what you have said, I know that from the beginning they have a lot of things at the airport. When everybody coming, they are taking your temperature, they are doing some isolation from the beginning. But now we realize that it is calm, so everybody has gone back again. But they are still doing the screening. But when you go to our borders, there are still problems. So what we communicate.
Wouldn't that be an indictment on us as a people? Because clearly, I remember last time we even had a conversation on Ebola where we would have personnel from the Ghana Health Service coming in and say, okay, we have this material, please put it in there. It appears I won't say the adrenaline, but the fear has subsided so greatly, and we are going about our normal duty. So what approach are you adopting so differently this time around? I understand that you're going to the communities, but let's now go down to the communities and understand how practically you are engaging. How many communities are you engaging?
2,000.
Is it on a pilot basis?
Well, it's the program has been running. It's a 6-month program, but more of communication using different approaches in 2,000 communities in all. But then we are even over, because some of the communities we spill out if we are here, but because we are using communication. For example, all the vehicles that we have mounted information megaphone on top with jingles, key messages, so many things. We are doing dawn and dusk broadcasts. The reason why we have selected some of these strategies was that at dawn, by 5 a.m., people are on their bed taking stock.
But these are things that we expect the Ministry of Information or Communication, for that matter, to be doing. They have information vans spread across the country. So how different is your approach then?
Basically, what we do is to use the services of these particular, information service vans to propagate our message. And so it's more or less a collaboration with different, organizations and institutions. We collaborate with Ghana Health Service, and they offer the technical, advice as far as cholera and Ebola is concerned. We partner with information service to, get their vehicles to go around selling the message out. But like you said, our borders are porous, and the fight against Ebola is so expensive that government cannot marshal all the resources to put all the necessary logistics at all the border posts. And that's the more reason why civil society groups, NGOs, and everybody who must come in to make sure that the right kind of information is sent to the people on the ground. And once the people have the right kind of information, then that alone is enough for them to also protect themselves. I remember not too long, it came in the media somewhere in 2014, where a sick person from, I think, neighboring country, Togo, came into Boku, and the news was everywhere because there was blood oozing from the person's, nose, mouth, and everybody thought that we had somebody with Ebola coming into the country. And so that is a classical case of how porous our borders are. And so we need to make sure that the right information is sent. And so if the
right information?
The information basically is to alert people that these are the signs and symptoms of Ebola. Let's take, for example, the borders are porous, but you have people who are well educated on the signs and symptoms of Ebola. Even if the borders are porous and these people see anybody at all coming in with showing some of these signs, at least they can restrict the person from coming in, because nobody would want to sit down aloof.
Are we not a bunch of fieros, a bunch of people who would want to just mind our own business and run away when we see Ebola face to face? You think people would readily go and apprehend or restrain someone who they suspect to be carrying Ebola, on a normal day? Really?
Of course, I think that to say we are all.
I'm asking because definitely you need protective gear.
Sure.
You understand it?
Sure.
Now, even with government's approach to tackling Ebola, there were many reports of inadequacies when it comes to protective gear.
Sure.
So if you are now also adding to the voice of government, going down to the rural areas to educate people on, Ebola, how ready are you? Because you go in there, for instance, to tell your story or to advise them or educate them on how to prevent Ebola, and you tell me to look out for the signs and symptoms. Clearly, I know it's highly contagious. So are you also going there with protective gear, since you're collaborating with the Ghana Health Service and you have other partners supporting your campaign? What is the approach?
You see, I told you that the National Preparedness Plan has different components. And civil society, with our strength, we basically look at community mobilization, community education, more on preventive. That is what we do as civil society. And that is the area that we are handling under the National Preparedness Plan. On protective gear and other things, I know DFID and other partners, WHO, all of them are providing those services, including the government of Ghana themselves. So DFID is supporting our campaign. And you see, I just want to raise the issue
support in terms of cash,
support
logistics.
of cash to help us reach out to our people in the various communities.
And then the Ghana Health Service is doing what?
They provide the technical support because that is their strength, the health area. But you see, the fear of Ebola, which we all have to take into when we are talking, is that it is very serious because it's destroying the health system. A lot of doctors have died. A lot of nurses who are supposed to be saving lives are dying through Ebola. So it tells you how weak our health system is. Because if all the doctors die, all the nurses die, then when other diseases, who takes care?
So clearly, the greatest caliber of persons who are at risk of contracting Ebola are the health workers. But then you're telling me that your approach is not targeted at these health workers, but rather, to the communities.
Yes.
Now, if the communities, for instance, are well educated on Ebola, what are your expectations in terms of results? Okay, now we know what Ebola is. We know that if we should see someone who is suspected to have contracted Ebola, then how do we manage in should I say, packaging this person for delivery to the hospitals? And how do we expect the hospitals to also take delivery of this sick person and clearly isolate this person? I'm looking at the very practical approach here, because then again, behavioral change is a very difficult thing. You go out there and you tell them these are the signs and symptoms to look out for, and yet you do not give them the protective gear and make them feel protected enough. That is where my worry is, because like I said, government approach, we've had many stories of no gloves, no protective gears, and the mask. So if you go down there and you go and talk to these people who clearly are very ignorant about even the very basic information, then again, how about the health posts?
Yeah, I understand what you are saying. You know, Ebola comes from the community to the health sector. And one thing that made some of the countries like Nigeria succeeded was because of contact tracing. And they partner community structures to make sure that any visitor, because if the visitor comes in, the visitor will stay with the family. Anybody who touches somebody with Ebola will immediately get the disease in the community before the health sector or whoever it is hears it. So our approach is actually preparing the people, one, on the signs and symptoms. He said something very beautiful, that in Boku, when people saw blood oozing, they thought that somebody has come in with Ebola. That alone tells you that people are aware. And immediately something like that happens, they will immediately call the health facility. And that is what we are communicating to people in the community. These are the signs and symptoms. When you see somebody, a visitor, a stranger, with any sign of symptom, especially blood, things that you can see, we share the health sector, their contact numbers with them, quickly alert them, so that they
move to these health sectors dotted in areas of operation in terms of your campaign. Did you feel that these health sectors were ready to take up cases of Ebola?
Actually, on the ground, there are no visible, structures in place. And then, like I said, a disease like Ebola is something very expensive for you to, handle. You take a place like Accra, with even the several hospitals that we have, we're only told that there's one isolation center, I think somewhere in Tema, which is meant for that. And so it would mean that if anybody at all should contract, let's say, Ebola, then efforts must be made to transfer the person to that particular place. You also did even indicate that in most of our hospital facilities, you get there, and even basic things like gloves and nose masks are not available. And these are typical things on the ground. And so what we seek to do, that through this particular education, other partners should also come in and see how they can also support in terms of providing this logistics. We should also make sure that we trumpet, very high our voices, so that government would hear that, look, the grounds are still not safe. And in case there's any outbreak of Ebola, it's going to be disastrous. So that by highlighting some of these things to government, I know government somehow should have information that in some of these places, these things are lacking. But let's continue to amplify our voices so that government, even with the limited resources we have, would make sure that they can channel some little resources to acquire some of these things into these particular places. Because you can never compromise the health of people on any grounds, because it is said that a healthy nation is a wealthy nation. So health is a critical thing.
Sure. Now let's get down to the practical bits. Let's take some of the communities you've visited so far. You mentioned what, 10,000, 20,000? 2,000 communities nationwide. That's it, right? Now let's have an appreciation of work done so far. When you move into these communities, what is the very practical thing that you do?
In the communities, what we try to do is to use community structures.
Such as?
Traditional leaders, women groups, church groups, youth groups, and all, because we know there are structures in the community, and to value for money, you don't go and start establishing new structures. And so we join them, we have video, we have communication materials, we use a lot of volunteers, community volunteers, who move to house, go to every household, they zone the communities and make sure that every household they visit and communicate to households on the issue of Ebola.
Let me hold you here. I need to take a short break. And when I come back, we would want to take the step-by-step approach, because this is clearly a communication strategy. We need to look at the situation analysis, the target groups, the strategy, the messages, and then look at the expected results. Let's do an evaluation. Let's come back and appreciate in terms of communication contextually. And when we come back, I'm sure for some people watching, they'll be thinking, well, we're talking Ebola, but yeah, we cannot deal with even cholera. So we'd also come back and look at how practically we will deal with cholera in 2015. Stay tuned. This is PM Express.
Another year is coming to an end. New year, new rent payment, new wahala. Oh, when will all this stop? Smile today, because Lifeline Properties is giving you an opportunity to own a home. You can benefit from their massive promo from now to the end of January 2015. Prices of houses have totally been reduced. In addition, for every deposit you make, you get a massive discount. Just deposit 20% payment and voila, you move into your own home and 5 years to pay the rest. Lifeline Properties has a state-of-the-art development at OEB behind Valley View University called the Vintage Residence. It's a gated community, so security is assured, constant flow of water, and backup electricity. Commercial and recreational centers are also available. Locate Lifeline Properties opposite Ghana Telecom University. Call 0266 032 113. Terms and conditions apply.
TV is organizing a national installer training throughout the country. The training is for fresh people who would like to learn more about multi-TV satellite installation. Trainees will also go through some marketing tutorials to turn them into result-oriented salesmen. Cost of training is 70 Ghana cedis, which includes ID card, certificate, lunch, and training manual. At Somanya, bigger form at Technosat. Training is on the 14th of March 2015. Volta region, pick a form at Creative Ventures in Ho. Training is on the 17th of March 2015 at Sogakopa. Pick a form at Creative Ventures. Training is on the 19th of March 2015. Greater Accra region, pick a form at Holy Link in Tama. Training is on the 21st of March, and in Accra, pick a form at Multi TV office. At Asimfosu, pick a form at Ayubis. Training there is on the 28th of March 2015. And at Kimoda, pick a form at Star Electronic. Training there is on the 31st of March 2015. To pick up a form, call 0302 211 688, 0244 340 424, and 0244 340 415.
You're still on PM Express, and tonight we're talking Ebola and cholera, focusing on the behavioral change and the communication-based approach, especially in our rural communities. We're asking questions, really, has the message gone down well with our people? I mean, our rural folks, brothers and sisters out there? It appears even for those of us who live in these urban areas. I mean, some of us are still very ignorant about the little things that we need to do to prevent Ebola and cholera. But then we should not be oblivious of the existence of our folks in the rural areas, especially for those who are engaged in hunting and gathering. And we've heard about tendencies of us contracting Ebola from consumption of bats and bush meat, and most of these people that live within the border towns. We are trying to focus on their existence today and how risky it is for them to contract or not to contract Ebola, and also vis-a-vis cholera. I'm in a conversation with Cecilia Senu, who's the Executive Director for Hope for Future Generations, which is an NGO committed to this call, and also with Abdul Majid Ayebire, Zonal Coordinator, Institute of Social Research and Development. These are two non-profit organizations committed to the fight against Ebola and cholera. And Cecilia, you were making a submission before I took a break. You were taking us through the practical rudiments in terms of the step-by-step approach.
Yeah.
Now let's talk communication. Okay. When you go down there, what is the situation that you observe? What are your observations?
In the communities, you realize that a lot of people don't really know about Ebola. For cholera, they are very much aware.
We would come to cholera,
okay.
but let's deal with
Ebola. The people in the communities, many of them are not aware of Ebola. They are not aware of signs and symptoms. I mean, they know that there is a disease, but how the disease comes. But there's a lot of myth and misconception associated with what they hear. And so these are some of the things that we address, using like churches, mosques, schools, social gatherings, and wherever you get people, house to house, interpersonal communication, yes. Focus group. We are using every communication strategy approach that we can easily do. So the staff are all in the communities doing all these messages.
So what has the reception been? Because we know that if you're doing or if you're conducting a research of this nature or embarking on such a communications campaign, there's almost always a tendency to be greeted with some level of apathy by the community. Some cannot be concerned about whatever message it is that you have for them. And I'm sure that you go telling them not to consume bush meat.
You'll be surprised. People call us to come and tell them about Ebola because really? I'm in Brown Hafo. Some of our team went to Brown Hafo, some of the villages. The report they brought was that there was a big funeral and they were in the information van playing the jingles. Then the chief called them that they should come. What are we? First, they asked them if they are selling drugs. And they said no. They are talking about Ebola. Then the chief said everybody should come in.
Before you go on, how could they have entered the community without the consent of the chief? Because clearly, from what I know with regards to such an approach, you need to go talk to the elders of the community.
That community is actually not part of our community.
Okay.
They are passing, traveling to our community. Then they pass a community that has a big funeral. And then the information van was playing the jingles. So the chief called them. What are you selling? I mean, that kind. So when they said they are talking about it, the chief said everybody should sit down. They should come and educate them. This tells you how hungry people are for information in the communities. And after talking to them, they asked like a lot of questions. And this alone tells you how people have embraced the project. And because we're using a participatory approach, it's not like sitting down and telling people do this, do this. We really invite a lot of things that they do. It's very interesting, using different strategies that engage the communities and for them to realize the need to take the preventive measures. And that is how the communities have embraced the project.
How, I mean, often what's your mode of communication or your medium of communication for that matter in terms of language and?
Depending on where you find yourself. If you find yourself within, let's say, northern region, and northern region you have so many tribes, so you'll be looking at volunteers who come from these particular communities. So if you are taking somebody from, let's say, Sang, which is a community in Kumungu, of course, the volunteer there is someone who comes from that particular place. So the native language is the language he speaks to the people. If you are taking somebody from, let's say, Cherpone, of course, probably the person speaks Konkumba, or the person speaks, let's say, Bimoba. Okay, so this is...
Hold on. Before you talked about volunteers, how are you able to get these volunteers? Before you actually walk into the communities, I'm sure you'd have done your legwork.
Sure.
So how long does it take you to do your legwork and you know, priming you ahead of your visit to these communities? What kind of persons do you recruit as volunteers to help you?
What we do is we go to introduce ourselves to, you know, the regional health directorate of all the regions we operate. You introduce yourself to them, you make them aware of, you know, your mission, okay? Then you try to, you know, spell out exactly what you want to do. At the end of the day, let me even indicate that in terms of even choosing the communities, we did not do the choosing of the communities ourselves. We had to really let them understand that this is what we seek to do. And these are the criteria we are looking out for to really choose a community. And so one, you'll be looking at, let's say, a community that is, you know, prone to, let's say, that cholera. And, you know, the health directorate have history of some of these diseases for almost all the communities within their jurisdiction. Now, you're also looking at communities that are border towns. You are looking at communities that have poor sanitation conditions. You You are looking at communities that are probably closer to water bodies. And so when you put out all these, criteria out to Ghana Health Service, they are able to quickly identify the communities that you should be working in. After identifying these particular communities, what you tell them is that you want to see how you can network with their volunteers to really carry out this particular exercise, because these are people who are knowledgeable in terms of how to reach out to the community members. And so what the Regional Health Directorate will do, is to make sure that they send letters out to their district regional offices, informing the various district health directors that there is a consortium that is into this particular exercise, and so give them your maximum support. Now, before we even get to a particular district, what we did was to organize regional stakeholders meeting. The regional stakeholders meeting brought all the various health directors, the district health directors in our operational districts to our regional center. We also made sure that other people who are key stakeholders in this particular exercise, we are talking of Ghana Immigration Service, you are talking of, civil society organizations, faith-based organizations. All these people were all invited. So we met at, a common ground where the regional stakeholders meeting took place. The exercise was briefed to them. A number of presentations were made. They made their inputs on how we could, get this particular work done.
Would go to a particular district or community at a time, comprising of what caliber of persons? Because you are NGOs, clearly you are not experts in the field. So what caliber of persons do you go so that when you present yourself to these communities, then they would see you as a very organized body of repute?
Yes, like I'm saying, during the stakeholders meeting, before the stakeholders meeting is even called, letters would have been sent out to the various district, health directors. So when they come, we elaborate on the issues, and then we both agree on days that we'll be visiting their communities to hold district stakeholders meetings in their areas too. And so let's say at the end of the regional stakeholders meeting, we meet with, let's say, the district health director for Kumbungu, and we say, oh, we are not done with the regional stakeholders meeting. When can we come to your place to have our district stakeholders meeting? Now, we expect that when we agree on the date, she would also support us to invite key stakeholders within her district for this particular exercise. And so when we meet at the district stakeholders meeting, after discussions, what we will now do is to make sure that we are able to schedule a date to meet with the volunteers, to give the volunteers the training. But before you even meet the volunteers, you would have asked for religious and traditional leaders. So we have a separate forum where we meet traditional and religious leaders, tell them of our mission, so because you can't enter the house.
When you meet these traditional leaders or these religious leaders, what do you tell them?
Can I maybe support? I told you the project, we are using different approaches. The churches, just imagine.
The message would be different.
Yes,
clearly.
In churches, we use because we orientated them on the key messages on Ebola. Basically, so
because for some people who are very, very superstitious, they may think Ebola is a spiritual disease.
That is why you have
so when you go to the church, that's what I'm asking, when you go to the churches, do you try to psych them out of that misconception that Ebola is perhaps a spiritual attack, to let them understand that, hey, this is a reality that exists, it's got nothing to do with spirituality, and that is the message. When you meet the other groups, the traditional groups, or the stakeholders, or the MCs, the DCs, or the chiefs, probably you tell them, my people or your people are in danger. We need to educate them. You need to have a healthy youth, because when Ebola wipes out the young generation, the community would suffer. That's the practical approach I am trying to elicit from you.
I think, as you said, we have different target groups, and we use different strategies. In the churches, everybody go to church, children, adult, everybody. So we are basically using the pew. We train the religious leaders on the issues, and they have accepted it. And so when they stand up there preaching, they communicate to their people. And that was how it works.
And most of sessions in the church to speak to the
Yes, we are giving sessions, and we allow the religious leaders who came to our training, because that is their role. You see, at the stakeholders meeting, we define roles for everybody.
So it's more like a trainers of...
trainer of trainers.
was it trainer of trainers?
Trainer of trainers.
Okay.
And so they stepped down that training. Well, will I say communication in their churches?
Okay.
We use the mosque. If you look, and then we've been giving them a lot of communication materials. So you see the imam giving education on Ebola.
But we are a community where, you know, or a community which believes in showing courtesy. We do a lot of handshakes and all that. How are you able to communicate that in terms of being careful? Because clearly we go to funerals, we're shaking hands, the chief sits at a dead bar. You cannot say the chief should not shake hands with his people, his elders, or people who are visiting the community, or invited guests for that matter, because of Ebola. I don't know if that message also went down well, unless that was not part of the campaign message you took down to the people.
I recall in one of our addresses, for example, during the stakeholders meeting, a question was raised about this particular handshake. And it was like, look, it's not going to be so easy for us to stop this handshake, because assuming a chief wants to give you a handshake, and let's say, for example, you are a sub-chief to the chief, and you decline to take that particular handshake, it could lead to this escapement. That issue really came up. But you see, the fact of the matter is that since the education is going out to everybody.
Do you also take sanitizers there?
No, but what we are, you know, talking is that people should wash their hands. But then there's that particular, you know, appeal from the people on the ground. For example, you go to the schools and you talk to them about hand washing, and they tell you that they lack the hand washing facilities. And so maybe if you could provide them with hand washing facilities.
Were you able to provide any?
We're still on the ground trying to see how we can, you know, mobilize resources and see how we can, you know, give them that particular, you know, support. But back to the issue of the handshake. And so once the education goes out to everybody, and everybody begins to know that, oh, it's becoming dangerous for us to shake hands because of Ebola, then of course, if I decline to take a handshake from you, you wouldn't get so much, you know, worried. Because I remember sometimes, even after education, you try to shake hands with some of the friends, they say, hey, Ebola, they say we shouldn't shake hands. So it means that people are beginning to, you know, receive the message.
Away from the handshake, Auntie Cecilia, of course, the handshake was one major campaign message. Be careful who you shake, always use sanitizers. And then it came to bushmeat. Yeah. Typically, bat, ampine, we call it, and then akrantia in our local parlance. Now, when you go to these rural settings, let's take a very poor hunter who thrives or lives daily on hunting. You go there and you tell him, oh, we are from Accra, we've spoken to your community leaders, we're here to educate you on Ebola. Bushmeat is dangerous because then you can easily contract Ebola. And here we are as a people, we believe that once the meat is cooked and well cooked, it's as good as anything, you can consume it. How were you able to convince such a person not to engage, maybe, in hunting? Alternative livelihood. That's all he does. So if you're asking him not to go hunting because there is a risk of contracting Ebola, then what are the alternatives you are giving to the people, especially in a high-risk hunting community?
I was in Dambai, one of the very rural community, and I was giving education on this. The people, that place is a fishing community. Bush meat is like a delicacy. I mean, because they've been eating fish all their life. So it's a delicacy to them in the community. So the chief asked me, so if you say we shouldn't touch bush meat, or if we see dead carcass we shouldn't touch, what do you want us to do? And I say, well, you know, there are two things happening now. For now, this is the issue. Don't take it, avoid it, and stay alive. Or you go and eat it, and then you die, and the whole family follows, because the way we treat our dead and the way we handle the sick as our culture is very dangerous. So the chief quickly said, okay, the best is to focus on our fish for now until you come back and tell us that continue the bush.
Ghanaians are not too worried about diseases which are transmitted from animals. We had the bird flu, we couldn't be bothered. We had the mad cow disease, we couldn't be bothered. Now we have Ebola. So if you're telling people, because then again, some can refer you and say, but when we had the influenza back then, the bird flu influenza, was it, in Asia, and then we had reported cases trickling down, and yet we thought, hey, we still survived it. We had a mad cow disease, we survived it. Ebola has come, we will still survive it. So when you have someone like me in the community who thinks, I'm sorry, but I'm not convinced, how would you convince me?
Let me share something with you. What we do a lot of our program with chief zones, the community health officers, and you know how Ghanaians respect doctors and nurses. I mean, when they see me as civil society, whether I'm a nurse or not, they don't care. But the moment you say this person is a nurse, whatever message, whether good or bad, that comes from the person, so they take it.
The issue of credibility.
Credibility, So mostly we do this with the nurses.
So you're saying, in other words, they do not find you credible unless you have some level of endorsement.
I'm not saying
by
that.
a health worker.
No, I'm not saying that. I'm just giving you a scenario of something.
Okay.
They believe us when they talk to them because we work in these communities and we have built the trust over the years.
Well.
I mean,
I would hold you there. Let me take my very last commercial break. When we come up, I would like you to wrap up on your success story so far and then the way forward with Ebola. And then we can spend a few minutes talking cholera because we don't seem to be making headway with cholera. And here we are spending almost 1 hour talking Ebola. So I'll take a break and when I come back, we'll continue with the conversation. This is PM Express. You're still watching PM Express and we're talking Ebola, cholera from the communications viewpoint, behavioral change approach, and I'm in a conversation with Cecilia Seno, who is the Executive Director for Hope for Future Generations, which is an NGO, and then Abdul Majid Ayebiri, Zonal Coordinator from the Institute of Social Research and Development, and of course, with a partnership from the Youth Development Research and Innovation Center, as well as the UK Aid. Together, they are embarking on an Ebola cholera outreach campaign with focus on behavioral change targeting rural communities. And we've talked so much about Ebola. We're now going to delve into our own backyard petty problem, you may call it, but yet we are not making headway. We'll talk cholera. 2014 was a bad year. We're hoping that 2015 would be a good year. But before we delve into cholera, I'd want us to wrap up on the conversation on Ebola. How far have you gone with this program, dotted around the nation?
Yeah, we are actually working in all the 10 regions. We have other projects running, but we have integrated Ebola and cholera into all of them. We are in, for example, Hope for Future Generation works in Volta, Greater Accra, Branhafo, and Western region. And UDRIC works in Central, Eastern, and Ashanti. And then ISRAD works in the 3 northern regions.
So these are all accredited NGOs?
NGOs, very credible, very recognized, very hardworking.
With very good funding, I'm sure?
Somehow. I mean,
yes, no?
I can't say yes, I can't say no, but we are grateful.
I hope the money is going into the campaign.
Of course.
Really?
That is why you see us here talking.
Well, this is just an outreach program on TV, but the real work goes on
We are on the ground, working day and night. We don't sleep.
So you believe if I should take my cameras and go down to any of these areas you've mentioned
you will be surprised
to find out if you are working out, get good results?
You will get the results.
Sure about that?
People are there. The whole Christmas, we didn't celebrate Christmas.
Really?
We were in the villages.
Well, if you have good money, you will celebrate Christmas. It's called work and happiness.
It might not necessarily be money, but it's the passion.
Really?
We cannot see our people dying from something that we can prevent.
Well, no one has died so far. We are hoping that no one will die.
No, but
so
cholera.
Let's talk about what is killing us so far, cholera.
Yeah, I think cholera is frightening. I mean, if you see Ghana, middle income, middle low income, and we are still dying of cholera.
It's a pity.
People laugh. People really laugh at us. And if you go out,
it's very laughable.
It is disgraceful.
But
what
really,
is causing this?
What is causing cholera? Eating the contaminated feces of another person. How simple could that be?
That is it. And we know that we are eating someone's feces. That is why we are getting the cholera. So it is our behavior. Why can't we stop it?
So what's the approach to dealing with cholera in these areas? Why the integration with Ebola and cholera in the first place? Or what is the priority? Was your focus more on Ebola or was more on cholera?
Both.
Both.
Both, because we believe that you can't get to a community and talk one disease and walk out. That is why we use the integrated approach.
But then again, you're looking at the high risk factor.
We are looking at...
What are we prone to, cholera or Ebola?
I think we are prone to all.
Really?
But cholera, it is clear now that the way cholera came and we died, very helpless. Ebola in
I don't think Ghanaians in 2014 were so scared of Ebola as much as... Well, maybe we were because it was something new to us, but we couldn't be bothered about cholera. Wouldn't you say?
That is the behavior change. It is our behavior. I mean, Ghana, everybody is aware. We know about mode of transmission of cholera. But the simple behavior that you take to protect yourself, I think we thought it's for somebody to do it for us.
How different was your message with the cholera in these areas as well?
You know, for cholera, it's something that the people are fully aware of. It is not like Ebola, where the people have no idea. You are talking to them and it looks like it's an imaginary thing. They can only imagine it, they can't see it, they can't feel it. But cholera is something that even in some of the communities we visited, they had issues of cholera. And so, yes, they had recorded, death cases, cases and even death cases as a result of cholera. So it was something that the people were even more interested to even know about it. You get the point. To even, broaden their horizons.
Annual ritual. When you got down to the grassroots, did you get a sense of total ignorance or partial ignorance on the part of the people? I'm asking because you were telling me that there was a certain zeal or willingness to learn. Did it give you the impression that for all these years that we had talked about cholera, it appears no message had ever gone down to these people?
You know what is happening?
No.
We are giving the message. We are not providing the facility.
Who's giving the message?
I mean, Ghana, everybody is talking about it.
Including yourself? You went to give the message?
Yeah, we give the message, but we also create the demand.
Let
me tell you something. We are Hope for Future Generation is implementing a project with Ghana Netherlands. It's a Ghana Netherlands WASH project, where we are educating people on open defecation. Recently, we went to a community called Media.
Okay, that's not too far away.
Not too far away.
Yeah.
You'll be surprised the way people defecated around the community.
Why?
Because they don't have toilets in their houses.
Whose duty is it to provide the toilets?
We have to look at it. The district assembly.
No, when you went there,
you see.
What were they saying?
No, they don't have the toilet. They have, I think,
public toilets.
One public toilet, and the whole community.
A community of how many people?
I think there are about 1,000 people. 2 people have household toilets.
Really?
And they use public toilets, and that is what the man used for business. Fine, it is okay.
But this area has a DC, has MCs.
Fine.
Possibly an MP.
So this is where we have to empower people to demand their rights. Because we pay tax.
Okay, so it appears that people do not know their rights.
People don't know their rights.
People do not demand of their leaders.
They don't demand their rights from their leaders. And after we do something, we call it CLT triggering, for them to see the effect of defecating around your house. And then when it rains...
But then again, sorry to cut you, but a common sense approach would tell you, okay, if it's not been done for us, we need to mobilize and do it ourselves.
And so that is what we have done. After all this...
But they didn't have to wait for you to get there.
No, it's that who has gone there to even tell them the effect? People defecate. It's nothing. Let's just defecate and put paper on it. And then when the fowls and the pigs and everything eat it, you walk from there. After doing the education, then they realize that we have a problem. Immediately, they started asking us to help them to get loan. Because the project also gives some sort of loan for everybody to have toilet in their houses. So, you pay, no, it's not but you pay over the years. It is better to spend your time and your money for something that will keep you healthy. Immediately, we recorded almost 50 people who are ready to pay for household toilet. Okay. So it is the message.
Okay. So what are we to expect in 2015 with all your campaign messages, Ebola and cholera? What do we expect for 2015?
But just to add to what she said.
Yeah.
On the ground, for example, cholera, they are aware of it. There was so much, appeal for, improved, drinking. Water. Yes, the request for potable drinking water, because you get to a community.
Were there enough health posts in these areas you visited? How close were, the available health posts?
We have the health posts, but we don't have the resources to really effectively manage the health posts.
Wow.
The project is actually partnering cheap compounds. You'll be surprised that basic resources are not there.
Too bad we have run out of time, but I believe that there's a lot that has been said regarding especially Ebola. We didn't talk much about cholera though, but I believe cholera is no news to almost all of us. And for me, I always believe in the common sense approach that we need to mobilize in as much as we all sit, we all wake up every day. If for nothing at all, we need to begin to read, we need to listen, we need to educate ourselves. We don't need to wait for the NGOs to come to our communities. We don't have to wait for government to come with interventions. I believe that when we decide to do it ourselves, we would get results, and of course, it would attract support. I want to say thank you to Cecilia Senu, Executive Director, Hope for Future Foundations, and Abdul Majid Ayebere, Zonal Coordinator, Institute for Social Research and Development, for coming to studio. And they were ably supported by the Youth Development Research and Innovation Center and then UK Aid. These are groups of NGOs together doing lots of work in the communities on Ebola and cholera. And we're hoping that we'll get them back into studio for us to have another conversation on how far they have gone and if indeed we are getting some result, because this is a communications-based approach, and definitely we have to come back and do an evaluation. Thank you for watching. This is PM Express. My name is Famous Kwesi Atichagbe. Thanks for watching.